Hello, Mr. Doe. My name is Tiffany. I'll be the nurse practitioner caring for you today. Today, I'm going to speak with you about your prostate. Okay, and ways to recognize trouble with your prostate. Okay, so what is a prostate? A prostate is a walnut-sized gland located between your bladder and your penis. All males have prostates. Um, Prostates are not viable to life, so you don't. It's not necessary to have one, but it is necessary to have a prostate if you want to reproduce. And what the prostate does, it secretes fluid that nourishes and protects your sperm. Okay, what can go wrong with this prostate? Um, Prostates can you with your prostate you can develop prostate cancer. You can have an enlarged prostate, which is benign prostate hyperplasia, or you can have prostatitis, which is inflammation or swelling of your prostate. Okay, um, how do you detect if you have a problem with your prostate? I'm just going to go down a list of signs and symptoms or things you should recognize, and I'm going to give you this handout. If you start to have those things, you should come in and seek a doctor. Okay, so burning and pain during urination. If you notice you're having trouble um, or pain when you're urinating, that's a problem. Difficulty urinating, trouble starting a stream. So when you start to urinate, if it takes a while for you to start your urination stream, that's a problem. If you have to strain when you're urinating, that could be a problem. Frequency in urinating at night. So if you notice that you have to get up multiple times to go to the restroom, that could be a problem. Loss in bladder control. If you just use the restroom on yourself throughout the day, or you notice you're dribbling, you're having wet underwear and you're dribbling, that could be a prostate issue. Decreased flow or weaker urine stream is a problem. Blood in your urine, or you're noticing blood when you're in your semen, so that could be another problem. Difficulty getting an erection can also be a trouble with your prostate, or if you're having painful ejaculations, that could be a problem with your prostate. Now, these signs and symptoms can also mean other things, but just coming in and seeking your doctor will narrow it down or rule out those other things, and we can let you know if you have something going on with your prostate. Now, the reason this is important is because the average age prostate cancer or abnormalities with your prostate is about 66. So men usually have prostate problems a little after your 60s. The average age men die with prostate cancer is about 80. Now with recent technology, prostate problems is very treatable. About 90% of prostate diseases are found when the disease is early. So that's why I stress the importance of the screenings, the routine screenings. Who's at risk for problems with their prostate? Now, there are several risk factors, and one being an African American male. You're at a higher risk for developing these problems if you're black. If you have a family history, your father, your grandfather have had prostate problems, then it's very important that you go and get checked. Being like I mentioned the 65 and above age, advanced age it puts you at higher risk. If you're obese or obesity is a risk factor, smoking or history of smoking, that's also um, a risk factor. Okay, so again, I stress the importance of those screenings. Early detections will always save lives. All right, so what do we mean by early detection or routine screenings? Speak with your doctor. We have two important screenings that will screen for these disorders, and that's digital rectal exam, an exam in which the doctor inserts the finger into your rectum to check if your prostate is enlarged. Another exam would be a blood test, and that's just drawing a little blood just to screen for the cancers, and they're testing for a prostate specific antigen or uh, a protein that the prostate secretes, and we're wanting to know how much is in your blood. All right, so like I said, when do you get this screening, or when is it important to get this screening? The American Cancer Society recommends men that are planning on living 10 more years. They recommend that you go ahead and get tested or receive the information from your doctor at about age 50. Okay, if you are at a higher risk, if you run a risk like we went over, African American, your family history, advanced age, obesity, or smoking, you want to go ahead and get that information before you turn 50. So I would go around 45 to 50, just to make sure that early detection is one of your is you know want to detect all those problems early. Okay, so that wraps up problems, how to recognize problems, and the reason it's important to recognize problems with your prostate. Do you have any questions for me? Okay, so I'm going to give you this pamphlet, and feel free to call me if you have any questions or concerns, and surely or remember to come in if you have any of those signs and symptoms. Okay, nice speaking with you. Take care.